Hello and welcome back for another episode of Deep Focus. I'm John Kiriakou. Robert F. Kennedy was a controversial choice for Secretary of Health and Human Services. Indeed, he was confirmed by the U.S. Senate in a 51-50 vote, with Vice President J.D. Vance breaking the tie. Kennedy has said some arguably stupid things, like when he proposed a national registry for people with autism, or when he cast doubt on the measles vaccine. But he has also said some very compelling things, like when he has complained publicly about the dyes and preservatives in the food that we eat every day. In my view, this is one of those cases where we need to listen to the individual message rather than to judge the messenger. Our guest today has a very interesting expertise. She knows more than just about any other American about what is in our food. How about this as an example? She found that much of the high fructose corn syrup in the United States was contaminated with mercury. That's right, mercury. And she found that there was a direct connection between inorganic mercury and glucose levels in the blood that showed dietary inorganic mercury exposure may be an even greater factor in the development of diabetes. In short, people are dying because there's mercury in high fructose corn syrup. In the end, our guest, Dr. Renee Dufault, resigned from the Food and Drug Administration. It didn't support her work, and it didn't want to make any of the changes that she had recommended. And now, almost 20 years after her whistleblowing, high fructose corn syrup is still in everything, and Americans are still the fattest people on earth. Dr. Dufault, thank you so much for being with us. Welcome back.
Thanks, John. I'm really excited to be here today.
I'm excited that you're here. So let's start with Bobby Kennedy Jr. I don't want to talk about autism or vaccines. Everybody's got an opinion. But I do want to talk about impurities in our foods. Bobby Kennedy announced that he wants to ban some of the most commonly used dyes from our foods. What do you think about this? It seems like a no-brainer. So if it is a no-brainer, why wasn't this done years ago or even decades ago?
Okay, so first of all, these dyes that he wants to ban are called certified food colors, and they are all petroleum-based, and they're made with petroleum. And we get petroleum from the ground. It's a mining process. You have a drill rig, and you drill down, and you bring up the petroleum. And so there are a lot of heavy metals in the ground, and that's where we mine them. You know, whether you want to mine for mercury or arsenic or lead, you have to dig for it. And so it's just, that a lot of people don't understand that petroleum is actually mined from the ground and it contains heavy metals. Same as coal. If you're burning coal, you're going to have, it comes in grades. You're going to have certain levels of mercury in coal. And when you burn, you get mercury releases. So people don't comprehend this, really. They don't even know the backstory. So these food colors, petroleum-based food colors, have been on the market before FDA became into being. So remember those snake oil wagons
Right.
drawn by horses back in the day? Well, these food colors were already being made. And so when FDA came into being, they were grandfathered in because, as is any product in America, there are corporate interests that want to be able to sell their products freely without regulation. And so all these years, these food colors have been in the market and used in, Fruit Loops and whatever to color. Well, the FDA knew that if you had too much of any one of these food colors, that you would have overexposures to heavy metals. And so they developed a certification process for these food colors, and it's codified in the Code of Federal Regulations under FDA's Title 21. And so it mandates that the manufacturers of these petroleum-based food colors must test each batch that it makes and determine that the level of heavy metals, specific heavy metals, that they're not above the allowable levels. So the allowable levels for yellow 5, yellow 6, and red 40, for example, are, 1 part per million mercury in each batch, or each sample. 3 parts per million arsenic, and 10 parts per million lead.
Oh my God.
Okay, so now we know, and CDC knows, and everybody in the world knows that these heavy metals can cause neurotoxic damage, and they impact child development, neurodevelopment, and learning. So back in the day, well, about 2010, actually, the European Union voted to require mandatory labels on all products, Fruit Loops, Skittles, whatever, that they had to be, if they had these food colors, they had to be labeled may cause inattention and hyperactivity in children. And so what happened was, when this label requirement came into being, these food colors disappeared from the European market. And I've been there. I did a keynote for a pediatrics conference a couple of years ago, and I went into it was in United Kingdom, and I went into several grocery stores, and sure enough, couldn't find these products anywhere. There were no yellow 5, yellow 6, red 40. And the food was so much cleaner, just overall, the labels. I mean, because I'm a label reader, because I want to know what's in everything. And it was just amazing. It was amazing. So these petroleum-based food dyes actually disappeared from the European market 15 years ago. Meanwhile, U.S. keeps, they have had no changes. And we're now seeing an uptick in autism and ADHD. And I teach, and my other job is teaching nowadays. So I would estimate that there are probably 25 to 30% of kids are either they've been identified as learning disabled, or they haven't. But nonetheless, there's 25 to 30% of kids that are having sensory processing issues, attention deficit, or whatever in the classroom, and that's all over America. And these rates, prevalence rates of autism and ADHD, which I have published. I publish every few years. I use the United States Special Education Database, because all the states have to report how many cases of autism, how many cases of other health impaired, developmental delay. All of these things are tracked. And I don't know if Trump's going to still track them, but that's how we know. That's one other source besides CDC's program of tracking. So the bottom line is we're seeing this huge impact on our children across generations. And the models I published long ago, and they continue to get refined, have been backed up by data, human data, clinical trial data all over the world. And we're seeing that there's this generational impact, from one generation to the next, because if the mother is eating the ultra-processed foods with all of these harmful chemicals and elements, we're not even talking about pesticides, but once you get that mix in the ultra-processed food supply, and then she's accumulating these heavy metals, then they get passed on to the baby via cord blood, and the baby then becomes overexposed. And then, this is what's happening. And we're getting the data now. U.S. isn't investigating this line of research, but it is being investigated, and it's very strong, very solid all over the world. We know kids that have autism and ADHD also have higher levels of specific heavy metals in their blood compared to their neurotypical peers. And it all starts with what mom is eating. And if mom's eating a lot of ultra-processed foods with, sodas like, Mountain Dew, Pepsi, whatever, all of these products have a lot of products have these fruit dyes.
I have to tell you, I was doing some research yesterday, and I saw two videos that really struck me. One was these guys put a Big Mac on the ground, and they put a banana on the ground, and they just did a time-lapse video. Well, over the next 6 or 8 hours, ants tore the banana down to nothing and just carried it off. And the ants wouldn't even climb onto the Big Mac. They didn't touch it. They didn't even try to get on it to check it out. They just ignored it.
Right.
And then in the next video I saw, this guy melted steel over this incredible flame, and he poured the molten steel on a Big Mac, and nothing happened to it. It didn't burn. It didn't singe. It didn't change colors. Nothing. You just poured the molten steel over the top of it, and it kind of just went off the sides. What is up with that? What is it that we're putting into our bodies? We think we're eating, a burger. Oh, you're getting some protein. Maybe it has a little bit too much salt. This is something far different from that. What is it that we're putting into our bodies here?
Well, nobody really knows
Oof.
exactly what we're getting when we buy all these processed foods. We do know that there are allowable pesticide residues in the crops, in the grains, and we know there's a difference between the grain that is conventionally grown and that is organic, because there's regulations. For example, wheat that's organic has to be stored in a refrigerated silo, and it can only be stored for up to a year because it doesn't have pesticides in it. And the pesticides like malathion are in conventional grains are applied up to 5 years. That grain can sit in a silo and have malathion applied numerous times to keep down the grasshoppers and whatnot. So, these things are pesticides and heavy metals are both, but they're toxic to living things. So a single-celled organism, whether it's bacteria or fungus or whatever, or insects, they cannot survive on when these elements are in the food. So I would guess the answer staying away from a hamburger that has all kinds of pesticide residues or whatnot in the bun. They're going to stay away because they can sense. Maybe they have a mechanism to sense something that's, like we can sense. We can sense when Roundup's been sprayed alongside of the road for weed kill. We can sense it. I mean, we can smell it, and we know, you don't want that exposure. So I'm sure that small animals and insects and whatnot, they also have sensing mechanisms, and they know to stay away from harmful chemicals. So I don't know why you would putting still doesn't, can't answer that question.
It did literally nothing, like not even to the bun. And I'll tell you, I rather enjoy McDonald's every once in a while. No more. Not after saying that.
Yeah.
No.
I never go. I haven't
No.
gone for, I don't do fast food. I cook everything from scratch.
Yeah, we have to if we want to stay alive. What you mentioned FDA rules and regulations and how these dyes were grandfathered in. What do you think it would take now to change some of the FDA rules that we have?
Well, FDA historically, they don't do any change unless they're authorized by Congress to make a change. And so, like, Congress dictates that they can, they can review new drugs or whatever, and they dictate that the drug companies will pay the salaries of the people who are determining whether or not these drugs should be on the market. So there's user fees, and Congress dictates all of that. And they don't have, they've never dictated, Congress doesn't dictate what can or cannot be in the food. Okay. And so even though we think FDA is there to protect us, whenever they've had a committee to look at an issue, like they did look at these food dye issues back in 2010 or 11, and they have these committees made up of a set number of companies, corporate representatives, and academic representatives who often get funding from corporations. And then they have one representative from a consumer group. And I remember putting together our comments on why these food dyes were so harmful to children way, 15 years ago. And we had several nonprofits who signed along with us. It was a very substantial letter dictating, saying why we think that they should be removed from the diet. And the one person, there was only one consumer advocate in that group, and I talked to her afterwards, and she said our document didn't make it into the review pile. And we had references and everything else. So it's it has been a very corrupt process. And so it's heavy, the corporations and the academic institutions that are often funded with corporate money. And like the American Society of Nutrition, for example, they receive a lot of support from General Mills or whatever for their conferences and whatnot. And so the professional organizations, they're all kind of tied in together. And so when they make their agree on, what the dietary guidelines should be or whatever, often, there's a lot of corporate input. And certainly there are few nonprofits out there advocating for child health or for better birth outcomes. There are some, but most of these people are not talking about the backstory. And, like I can say what the backstory is and point to the title in the Code of Federal Regulations that talk about the certification process for these food dyes and how much heavy metals are allowed. And I guess I can do that because I'm a former FDA person and they figure, well, she must know what she's talking about. But I don't hear any of these nonprofits out there talking about the backstory. With investigative journalism, oftentimes, you think a really good piece will come out that's been written by somebody, but did they get it all? Did they have the backstory?
Right.
And oftentimes, the backstory, there's stuff that's missing, big time stuff that's missing. So, it's.
I wanted to talk about that. I'm sorry to interrupt you, but you and I have had a conversation in the past. You were on my show, The Whistleblowers, and we talked about your whistleblowing. I remember your whistleblowing, and I remember being angered by what I learned. It made me angry because I actually felt like I saw much of myself in what you wrote. I grew up in the 1970s. I remember the craze against fat and cholesterol. It was a thing in the 70s. I remember the transition into high fructose corn syrup instead of sugar. And I remember watching the entire country then get fat. I was one of those people who got fat. I developed diabetes in 2005 when I was 41 years old. So take us back to the origins of your research. High fructose corn syrup is bad, but you also found inorganic mercury in high fructose corn syrup. So tell us about that.
Okay, well, it was an accident, really. I stumbled on the finding.
You're kidding.
What happened was, well, the U.S. Geological Survey knew that I was doing research on mercury in general because I was finding it in the plumbing systems of research laboratories that I was decommissioning. I was the point person for EPA for 4 years and then FDA. I was the point person for decommissioning all the research labs. And we kept finding mercury in the plumbing systems. Well, I asked, where did that come from? And a group in Massachusetts, like a membership group, MASCO is what they were called. They were looking at the mercury effluent coming out of hospitals. So hospitals, wastewater, there was a lot of mercury coming out. And they had tracked it down to specific chemicals being used to clean surfaces and whatnot, and just chemicals that were in the hospital environment that could end up in the wastewater. And so it turned out that these chemicals are made by the chlor-alkali industry, which is back in those days. And there were 9 mercury cell chlor-alkali plants left in the U.S. Now there's 2, I think. But there's still 30 some odd plants left in the world. So it's still an issue. And if food manufacturers can't get mercury grade products, chlor-alkali products here, then they can import them. So one thing Congress could do would be to ban mercury grade chlor-alkali products if they don't want it in our food. Because, for example, mercury grade chlorine is used to bleach flour, and there's an allowable level of mercury in flour that is then used to make bread. And that is a way that you can keep bread from molding, in addition to the insecticides and the mold fungicides. Fungicides are used to kill mold. So bottom line is there's this group of chemicals that are made with mercury, and there's always mercury residue in these chemicals. And so I had the USGS had asked me to do a PowerPoint presentation at their conference on the Mercury cycle. So one of the questions I asked when I was doing that research was, okay, if these mercury grade chemicals are being made and they're found in the products, well, who's using those products? Well, the biggest user at that time was the high fructose corn syrup makers, the corn refiners. And so I thought, well, gee whiz, I wonder if we have mercury in the corn syrup, then, high fructose corn syrup. So I tasked a FDA law enforcement agent to go out to a few different corn refiners unannounced to pick up samples. And then we would test them. And I had a couple labs lined up to test them. And we found mercury in about 45% of the samples. And I did interview a organic corn refiner, and he told me that, oh yeah, we use mercury grade chemicals because it's good for product shelf life. And he ended up leaving the business, and there's no more organic corn refiners now, but there was one at the time, and they didn't understand, that mercury was an issue. So anyway, I wanted to publish those findings. I had published a mercury toxicity model and explained why it was not good for kids and, in child health and what. And I even had pediatricians at FDA review the paper, and I had collaborators at universities that signed on, and there was positive feedback. Yeah, we need to get this published. But the higher ups, when I presented the findings to the Center for Food, CFSAN, Center for Food Safety and Nutrition, Applied Nutrition, they told me to quit investigating. I couldn't investigate anymore. And then when I wanted to publish, I was forbidden to use the data that I had gathered from the federal laboratory. And so it was like they didn't want it published. So I ended up retiring early, and I still had samples left, and my supervisor allowed me to send them to a different federal lab for safekeeping. And that's where they stayed until after I retired. And then those same samples that were on chain of custody. So they were still, law enforcement collected and then properly frozen. I asked, could we give them to the University of Wisconsin? And they said yes. And so then those mercury analysis were done there, and then we could get the same results, and we were able to publish. But it took a couple years, because it's a big process of doing analysis, and then you write your paper, you write your findings, and then you have to submit for peer review. And that process can take a while. The first time we submitted, they said the paper was too long.
Yes.
So we had to divide it up into two papers, one about the mercury in the corn syrup and one about what it would do to our children. And so then there were two papers, and that, two journals and two publications. And so all of that takes time. But in order to get any credibility in science, you have to publish, and you have to go through the peer review process. And our ducks were in a row, and these have many, many citations. So then the corn refiners claimed that they weren't using mercury grade chlor-alkali products anymore in 2009. But in Canada, some researchers got some fresh samples of corn syrup products, and they found mercury in those. So, no one, there was another group in 2009 that got samples of food products, Institute for Agricultural Trade Policy, and I gave them some guidance on what products to select, and any product with first or second ingredient high fructose corn syrup. And so they did an analysis and found mercury in a certain percentage of them. So they are still using, and nothing's been done since. But we do know, except we did a clinical trial, and we did find the connection between ultra-processed food consumption and mercury levels in the blood, and the subsequent positive association with fasting glucose. So the more processed food you eat, the higher the inorganic mercury and the higher your glucose levels. And that was published. And so there's a backstory on that. I mean, I don't even want to, but I can assure you that the corporations have a lot of power that we don't even, if you had a show on, let's have a story about how a corporation influenced something. There'd be so many stories out there because they have a lot of power to suppress.
I want to talk about your response to all this too. You developed a model called macroepigenetics. Your
Right,
model describes these dietary factors that impact gene behavior in the human
right.
body and that can bring about perhaps autism, ADHD, other maladies. You found a possible link between high fructose corn syrup consumption and autism. You've hinted at that a couple of times. And further, you found that high consumption of high fructose corn syrup causes, and this I didn't understand, causes a loss of zinc and calcium, which can
Right.
then impair a child's ability to flush toxic metals like mercury from his or
And
her
lead.
system, and it impacts the brain. Tell us about that. And tell us also, if you could, about the reception that this research received in the scientific community.
Okay, that was published in 2012 after the 2009, and it was just an expansion of the first model because the basic concepts are there. There's foundational science, basic concept shown. This is a fact, right? And so what's happened since that was published was researchers out of UC Davis, I think in 2022 or 2023, did a study on college students consuming high fructose corn syrup and some other sugars, and they found that the high fructose corn syrup did in fact still lead to zinc losses. So that is I think we can. That's a fact. It's been backed by more than one clinical trial. And by the way, consumption of yellow 5 or 6 in a couple studies in the European Union also led to zinc loss. And why would it lead to zinc loss? Well, if there's heavy metals in the product, then your gene that is responsible for having a metal carrier protein being built, it's a zinc dependent gene. And so as you're taking these heavy metals out, you're going to lose zinc because that's the way the gene works. And you need the gene. The gene needs zinc in order to build the molecule. And so the heavy metals kind of displace the zinc on the metal carrier gene. It's like a bus. And then they're taken out of the body. So the more heavy metals you have, the more zinc deficient you're going to become. Does that make sense?
Sure
So this
does.
is a fact in toxicology. And so if you're consuming, like back in the day when I first did the study on the fructose, that's the average American was consuming 60 pounds of high fructose corn syrup a year. Well, compared to 1 pound of broccoli, that gives you what just so it was ridiculous. The consumption was ridiculous. And now they're about 23, 24 pounds per year, the average individual. So still that's a lot of a substance that is going to bring about zinc loss. Okay. So when you lose the zinc, then you're going to be more susceptible to a lot of things because zinc isn't just a building block for metallothionein, which is the protein we're talking about, the metal carrier protein. It's also important for other genes and proteins, and it's key to the immune system. So, this ultra processed food supply really makes us more susceptible to disease because our immune systems are being weakened. And then we're going to end up with cancer and diabetes and all of these things that are dietary related. And I don't know if I answered your
You
question, but
did. You did. And
that model, the one in 2012, there's more to it, because we talk about the PON1 gene and how that's calcium dependent. And that if you're consuming fructose, then that also can be shed. And you need that PON1 gene to be working right to be able to excrete the organophosphate pesticides like Roundup. That's residues are in all kinds of our foods. So, you have to look at these interactions. And unfortunately, the United States hasn't been geared to be looking at these interactions so much as looking at new patents for pharmaceuticals. And they are driven by money and capitalism. They're not driven by, well, what can we do to get healthier? How do we prevent disease in the first place?
right, right. And extend your life at the same time.
Exactly. Yeah.
I want to ask you specifically about autism. There's a school of thought that more and more people are being diagnosed with autism because the diagnostics have improved. But your research seems to find that it's just getting worse. That's why there are more people being diagnosed with autism. Is that what you found? And if
Oh,
the answer is yes, does it really come back to high fructose corn syrup?
uh, it comes back to the ultra processed food supply, period. Okay,
Oh,
because even studies done in other countries are showing that the ultra processed food consumption by the mother, prenatal consumption,
wow.
and during pregnancy is linked in numerous studies to poor birth outcomes and the development of autism and ADHD. So, high fructose corn syrup is one ingredient. Yellow 5, yellow 6, another ingredient, both found to lead to zinc loss. So, we're talking about areas that have not been studied because these epigenetics, nutritional epigenetics, which is the line of research that really started long ago, and one of our first models is, that's what it is. And this is not a line of research that is being conducted uh, in the US. I mean, it's been ignored. It's being done all over the world. And it's great because everything I've been saying is coming, it's now rising. The cream rises to the top. And especially when it's science based and studies are duplicated, and like the zinc shedding with fructose, uh, when there's studies done and they're 20 years apart and you get the same result, then hello, maybe that's what's really happening. So, like the US has not been geared towards looking at how what we eat determines what disease we get, what's happening to the nutrient levels in our systems, in our body systems when we eat certain things. And it's just been kind of a weak, I have to say weak, compared to what's being done elsewhere. And we are falling behind, the US science community research has been falling behind for a number of years. And, there's other countries that are moving forward and becoming champions in areas that we're not. And part of that is because we're so focused on the next patent, the next pharmaceutical. How can we make money, instead of the health of the population? And how can we improve health? How can we improve child learning? How can we reduce these learning disabilities so that our kids can serve in the military and they can, do technical jobs and, good reading, good writing skills and whatnot. Yeah.
You founded a nonprofit called the Food Ingredient Health Research Institute, and you have been advocating for food ingredient safety, for better food and nutrition education, for increased research, because you're right, we are falling behind. So tell us about that work. Tell us about some of the successes you've had, and where can people read more about it?
Okay. So we have a new website.
Oh,
I'm the webmaster. Hello. And we don't have any paid staff. We're all volunteers. And I pull expertise from collaborators at universities and elsewhere that have been part of my team for years. And we are at www.foodingredientsafety.org. That's our newest, and because there was too much text on the other one, and I wanted more visuals. So foodingredientsafety.org. And all our papers are there with beneath short paragraphs so that, the findings, major findings, like the autism prevalence, ADHD, uh, glucose and mercury connection. We've created a curriculum that's been used in 3 different clinical trials that shows that if people understand certain ways of looking at nutrition and understanding where the heavy metals are and pesticides and how to eat healthier, how to read labels, that then you can improve their dietary intake of organic and whole vegetables, and they'll stay away from the ultra processed foods and reduce them significantly if they kind of understand what's going on. You have to teach them what's going on. And once you teach them, and I've taught to different levels of education, men that are just out of prison. I've taught community college students and mothers pregnant, expecting, not expecting, but mothers of children with autism and ADHD. The harm is already done. And all of them have switched diets once they understand. And so what they don't do in the U.S., which is a real problem, is they keep all these experts are saying, we don't know what it is about the ultra-processed food that makes us sick. It's like, well, why don't you know? Don't you read the Code of Federal Regulations? Don't you understand what's allowed? Why these ingredients are made the way they are made to be? And the ignorance is just amazing to me that they keep saying this mantra that we don't know what it is about the ultra-processed food. When we do know a lot, we don't know everything, but we know more than what they're letting on, right? And the government doesn't want you to know things. That's why it's not part of the narrative. The backstory is not being told.
Right. Dr. Renee Dufault, thank you so much for being with us. Thanks for helping me clean up my diet. I mean, after a conversation like this, what are you going to do? You can't eat McDonald's anymore.
Wouldn't recommend it.
No. Even that delicious filet of fish, I just can't do it anymore. No more.
Well, if you move to Hawaii and you have real clean ahi.
That's right.
And we've already done the studies here. We know that the mercury is not of consequence here because we're so isolated and the selenium levels are right in the ahi here. So we don't,
good Lord,
we don't have a mercury issue. And you have that fresh ahi.
Mm-hmm.
And, you'll never want another fish burger from McDonald's.
No, you're absolutely
It'd be
right.
like eating cardboard. You got to have the real thing.
That's
and
right.
Once you've had the real thing and you've had it enough, then you can't go back.
No, there's no going back. You're absolutely right. Well, thanks again for being with us. It's great to see you.